in the war on drugs is not only a problem that the government has to deal with, but it's also a problem of the ordinary citizen.
That's right.
Now, what are some of the parts that parents might be able to play in this as a war?
Well, I think parents are probably the most important player. And it's kind of interesting, we surveyed young people first to get some idea of the level of drug use out there just in Tennessee. Then the following year we surveyed parents to get some idea of the perceptions parents had and what parents were doing. And what we found was that children were very much influenced by what their parents told them about alcohol and drugs. But that parents didn't think that their kids listened to that. So, you know, a very important thing for us was to get that message out to parents that kids are looking to you for direction. And I think one of the most important things that parents can do is to talk to their kids about what their expectations are. I think a lot of parents just you know, they take it for granted that, you know, well, Johnny or Sue knows that I don't want them doing this. But maybe they've never really sat down and told them and laid out some consequences for that. And given them their own personal views on the issue. Those things are very important with kids. The other thing, in addition to talking to them about alcohol and drugs, is to work with them in terms of just their basic ability to make a decision, to weigh consequences, to assert themselves with their peers, to build their self-confidence. You know, we tell kids to say no, but a lot of times that's harder than we give kids credit for. And if a kid's not feeling too good about themselves, it's very easy for them to be swayed by peer pressure.
Now, this program has been in operation since 1987, has it not?
Right.
Well, have you any statistical information that would indicate that you're being successful in some areas and that you need to do more work in other areas? Or what kind of information or feedback do you have, some 4 years later after the initiation of the program?
Well, we're trying to get that kind of information. It's a very difficult problem to be able to say, well, we did this and we know that it caused this to happen, because there are so many factors built into it. We have conducted formal evaluations on the results of the Drug-Free Youth Act, getting ready to release that information here probably in the coming month. And it looks like we've had some positive changes there, that kids are telling us that it has made a difference for them. We know from national surveys that have included Tennessee that overall illicit drug use is declining, has been declining since 1979. Unfortunately, illicit drug use was at a peak in 1979. During that year, 55% of high school seniors reported using an illicit drug during the last year. Most recently, that number is down to about 33%. So, you know, we are seeing a decline, but when you look at the fact that a third of our kids are still telling us that they've used illicit drugs, which doesn't even include alcohol, which is...
Now, alcohol is not included in
well, it wasn't included in that survey. We very much think that alcohol needs to be included when you're talking about, obviously, addressing alcohol and drug problems. You know, sometimes we don't, I think, care to admit it, but, you know, alcohol far and away is our biggest drug problem. Kills more people, costs us more, so we have to address that. And it is illegal for anyone under 21 years of age. Similarly with alcohol, though not near the same levels, we have seen some very gradual declines. one kind of disturbing piece is that cigarette smoking throughout that whole time has pretty much stayed level and has actually increased.
And of course, cigarette smoking is also included as one of the drugs.
Right.
Okay.
Well, yeah. One of the things we do with kids is we focus on what we call gateway drugs. And the gateway drugs are tobacco, alcohol, and marijuana. You know, a person that's going to become involved with drugs, they don't walk out and immediately start doing crack or cocaine. They tend to start with one of the three gateway drugs. And we know that if we can keep them away from the gateway drugs, that they're not going to be fooling with some of these other drugs. We also know that the longer that we can keep young people from experimenting, the less the likelihood that they're going to develop a serious problem. A young person that begins to drink or experiment with illicit drugs before the age of 15 is 3 times greater. There's a 3 times greater likelihood of them developing a problem than if they had waited until they were 19. So particularly with young people, we're trying to get that average age of first use up as high as we can. Most recent surveys have, told us that, kids are starting to experiment with alcohol and drugs at 11, 12 years of age. So we really need to do all we can to move that age up and keep kids away from gateway drugs.
Now that's, for the most part, education and